What was the prompt to get to ask for military medical staff from the Red Cross to come in now?
Well, thanks for having me, Evan, and appreciate the opportunity to be here. Look, we know as a government, we're going to do anything and everything we can to ensure the safety of all Ontarians. This is just another measure in terms of support through healthcare workers to assist our frontline workers that are currently in our healthcare system. We have enacted some strong public health measures. We have seen some of the effect of that, as Dr. Williams noted last week, of some of the cases and trajectory coming down, but we still need some of those resources, and we have reached out. One of the other requests we've also made is to secure our borders to ensure that we don't have new variants entering into Ontario as we grapple with this third wave, and we really want to ensure that all of us are working together to solve the issues at hand.
Right. Okay, did the request for the military and the Red Cross come after your government requested other premiers to ask for their help? In other words, was it before the letters went out to the premiers asking if they could lend people like Newfoundland and Labrador are doing, or after?
So Premier Ford has been working around the clock in terms of reaching out to his counterparts across each province, whether it was Newfoundland, other provinces in British Columbia, in Alberta, etc. We do recognize that there is a need for all of us to work together as we continue to onboard more critical care beds, over 30 across Ontario, and so as of this Friday, our team has reached out and requested the support of our military officials in this regard, and it's something that collectively working together and recognizing that the third wave across all of Canada is of concern. We did make the request to ensure that our frontline responders, frontline officials here in the province continue to get the support they need, but as well as
how fast will the military get there?
Well, this is what both the Solicitor General, the Premier, and our entire team is working with the federal government on the logistics of it. So, hopefully in the coming days, as we go through this, the province is prepared and working with our federal partners. But we've also numerous times also requested stronger measures at our borders to ensure that specifically around new variants entering into the province.
I get that. No, I get that, and I think that's a fair comment. I just want to focus on this, though, because 10 days ago, your government rejected federal assistance for the mobile vaccine units. But this weekend, there was long lineups at pop-up vaccine clinics in hotspot neighborhoods. You've seen these lineups. It's insane what we're seeing here. Why did your government reject help for mobile vaccination units when people are literally lining up for hours to get vaccines?
Well, Evan, one of the things on the aspect of mobile clinics or even vaccine administration, we have the ability to roll out to 300,000 vaccines in a day. And that's why, we've requested the government numerous times to ensure that they increase supply. Just today in, my riding in my city of Brampton, we're rolling out in the next day, vaccination of essential workers, whether it's at Maple Leaf Farm, Maple Lodge Farms, and at some point Amazon and other employers as well. We do have the ability and capacity to drive vaccinations in our communities, and we have a robust and strong system and infrastructure set up to do that. So we'll continue to roll that out as the supply increases. We can get through this third wave, especially by redirecting more resources to those hotspots.
Okay, but, well, let's talk about that, because the province said it would reallocate 25% of its vaccine supply to hotspots, but you had been urged by the science table to do 50%. I know you're now continuing it, but unfortunately, you're an MPP from Brampton. As you know, there's a 13-year-old girl, Emily Vegas, died last week, the youngest person to die from COVID-19, obviously very tragic. By the way, her father, an essential worker, but let me just ask you a question. Why is your government waiting to allocate 50% of the vaccines to the hot zones if people are dying there?
Well, we have allocated the 25% here in Brampton as well on the pharmacy rollout. Peel has over 150 pharmacies. We are rolling in support to essential workers as well as the science table has requested. As Minister Elliott has also mentioned earlier today, we're looking at increasing that to 50% as supply increases, but we do recognize we need to go into hot zones, and that's exactly why we've shifted not only to supporting in those hot zones, but those essential workers that are getting vaccinated. We're also opening it up to the broader community to ensure that those 18 and over can also have access to those vaccines. And as Dr. Lowe, the Peel Medical Officer of Health here in Peel Region, develops his plan on the pop-up centers, we're going to be there to support them all along the way and ensure that we get vaccines into hot zones.
Yeah, to be fair, even Peel Region's shutting down businesses that the province didn't shut down, essential businesses. But I only have about 10 seconds here. You know, the mayor in your province in Brampton, where you are, Mayor Patrick Brown, has said that he would like the Pearson International Airport to close down, fully stop. Does your government support that?
Well, we're supporting, non-essential flights not coming into Pearson International because we know that the border and the variants that can come in through the border present a significant challenge to Ontario as we fight the third wave. We know that the variant that originated out of the UK has ravaged through Ontario, so we think stronger border measures are very important and needed here in the province to continue controlling, the variants that are overtaking Ontario and all of Canada at the current moment.
All right, Prabmeet Sarkaria, great to have you on the program, the Associate Minister of Small Business and Red Tape Reduction. I appreciate giving that perspective.